In the first half of January, an estimated 8.8 million U.S. workers reportedly stayed home, either because they were sick with COVID or caring for someone who was sick. According to Stacia, this is not only an increase of over 2 million people year over year, but also the biggest workforce shortage since the start of the pandemic. This comes as some workers are running out of sick days from their employers. Here to discuss this and more is Jorge Mujica, a strategic organizer for the community labor advocate organization Arise Chicago. Jorge, welcome back and thanks for joining us. So when employees have to take off for COVID-related sickness, how are they impacted?
Well, with a loss of income to start with. In some cases, employers take vacation time as sick time. I know vacation and sick time is not the same thing, but legally they are authorized to do that. So in those cases, you may get paid, but it also depends on how many vacation days you have. If you have 5 days a year and your disease, your sickness lasts 10 days, then you would lose 5 days at least. I think that's the general denominator, loss of income.
Right. And then what about the employers themselves? How are they impacted?
Oh, well, the employers, of course, get impacted because you are not producing, you are not making money for them. So obviously, they don't want that. We have seen many cases workers have denounced that employers are forcing them to go even when they test positive. They say, if you don't have any symptoms, just come over and keep working as if nothing had happened. That's incredibly dangerous from the health point of view, too.
Now, earlier today, we spoke with a factory worker who took unpaid leave for 5 days because she needed to care for her 3-year-old son who tested positive for COVID. Here she is.
Yo tuve a mi hijo que dio positivo y estuvo enfermo, estuvo con fiebre como 3 días más o menos. En cuanto me enteré, pues obviamente le dije a mi supervisor que pues mi hijo había dado positivo, pero yo no. Pues nada más dijeron, pues como yo no tuve COVID, pues esa es la razón de que no me van a pagar, porque anteriormente yo había sabido que sí pagaban si un hijo salía positivo, pero en este caso, pues supuestamente ellos ya las reglas ya cambiaron y ya no están pagando.
Now, Genesis Mantuano, they are saying that her employer told her that because it was not her, it was her son who had tested positive, that they would not be paying her for the sick time that she had taken. Jorge, explain to us what the situation is currently like for workers when it comes to sick days. Are you still hearing from a lot of people who need to take time off because of this Omicron surge?
Definitely, yes, more than ever before. And people have in mind that in 2020, you got paid for your quarantine up to 80 hours if you got sick or if your relatives got sick. But that ended in December of 2020. There was a small extension to March of 2021, depending on if the employer wanted to pay you. But people still have the idea, so they are still asking employers to pay for their quarantine, and employers are flatly, denying that petition. So that's what we're seeing. Not only workers getting sick, but their family getting sick. And if you have 2 small children, your nanny is not going to be taking care of 2 sick children. She's going to stay away. So you have to stay home to take care of them.
And of course, that is for people who are fortunate enough to have a nanny. Now, at the end, Genesis there was referring, and you as well were referring to the Families First Coronavirus Response Act, which used to require employers to provide paid sick leave to employees who are unable to work due to COVID-19 related reasons, including caring for sick family members. You mentioned that extension, but that ended in March 2021, so that's nearly a year ago, back when the vaccine became widely available. Has there been anything to replace this since?
Not at all. Absolutely not. Chicago and 22 cities in Cook County have the what is called the earned sick days. You earn sick time as you go working. But that starts on calendar year. Starting on January 1st, for every 40 hours you work, you accumulate 1 hour of paid sick leave. But that means that so far, in these 3 weeks, you have accumulated like 45 minutes of paid sick leave. By the end of October, you will have full 5 days. But that's if you don't get sick before. So that doesn't cut it. And that's the only provision there is in the land for paid sick leave.
So there are no other protections then for employees who don't have the remote work option?
No, unless you have a collective bargaining agreement, with a labor union, then maybe you get it, or you get paid vacation, and so you take your vacation time as sick leave.
Jorge, do you foresee, any new law or mandate in Illinois soon that could, given especially, these recent surges with Omicron, anything else that's coming that can protect workers?
Nothing at all. And the situation is even worse because of that CDC 5-day notice thing. Employers are telling people, oh, after 5 days, you come back to work. Don't even get tested anymore, because the CDC say 5 days, so I want you back in 5 days. And nobody I know of is working on extending paid sick leave to anyone in Illinois.
Okay. And quickly before we let you go, Jorge, anything that employers can do to better protect their employees?
Well, of course, comply with all the precautions in the workplace. Be careful to watch that everybody wears a mask, vaccinated or not vaccinated, that everybody wears a mask. If possible, to still keep social distance, do it. Wash your hands every so often. Scattered shifts, so not everybody gets at the same time trying to punch in. 10 workers by 10 workers by 10 workers every 5 minutes, something like that.
Yeah, continuing to maintain some of the practices that we've all had to put in place over the last couple of years. Jorge Mujica at Arise Chicago, thank you so much for joining us.
Thank you.